They say life slows down after 40. They say after 40, it's all downhill.
We say it's just the beginning.
Welcome to What She's Having, the podcast that proves getting older is the ultimate glow up.
We are your hosts, Jennifer Cataldo and Brittany Semler, two best friends, moms, business owners, and professional fun havers, living proof that the second half is the better half.
Yes, you can be over 40 and still over the top fabulous, thriving, stylish, and a little bit wild.
Think luxury travel, wellness that actually works. Beauty tips we don't gatekeep, mixed with a little mischief, because aging gracefully is expected, but aging boldly, even better.
We're spilling our favorite beauty hacks, wellness secrets, travel obsessions, and why Botox and belly laughs are equally essential. So come for the fashion, stay for the friendship, and trust us, you're going to want what she's having. Today on What She's Having, we're spilling the tea and maybe enhancing a few things with our fabulous friend and board-certified boob whisperer, Dr. Michael Schwartz. Based in Westlake, he's the man behind some of the best busts in Southern California. And trust us, he has seen it all.
From what's trending in the OR to what's really going down in the DMs, we're getting real about plastic surgery, confidence, and why a good doc is just as essential as a good bra. So grab your wine or your wish list and let's get into it, because today we're having what he's enhancing.
Welcome.
Thanks.
Dr. Michael Schwartz. This is incredible having you here. And so everyone knows Dr. Schwartz is private practice for over 25 years, double certified board plastic surgeon and general surgeon,
Right.
and a meticulous eye for detail. And that's why your clients, patients, including us, are very happy. And I will say there's a lot of people in this room and there's not a boob in here you have not touched.
Uh-oh.
Let's get into talk.
Talk. Okay.
Or titty talk.
Titty time. All right.
I'm so excited that you're here. You are our doctor, but you're also our very dear friend, our neighbor, and somebody that we share the most amazing moments in our life with. So thank you for coming
For
here.
sure. My pleasure.
You're an incredible surgeon, but you're also an incredible artist. And I don't think a lot of people know that. And that really is where I see your talent crossing both ways. And you're a phenomenal golfer. You are so precise. It's so crazy. Everything you do is precision, and it really comes through in all of your surgeries. Like my scars are non-existent.
Well, the trick is obviously good training and a little bit of a gift that somebody gives you that you're fortunate enough to learn how to take advantage of. And then, like you said, the attention to detail, right? Like really, really focusing on every step of every single thing that you do. And I mean, that's just kind of how I learned to do it. And I'm so glad I'm blessed to be able to kind of deliver what you said.
Well, there's not probably a breast in town that you haven't touched, right?
True.
I have my Schwartzies out today. We all call them our Schwartzies, right? They're the
I
best
have mine.
Schwartzies. We love our
Yay.
Schwartzies.
Okay. I have mine too, but they're different.
Quick question. When you see women, do you kind of think pre or post surgery, they made a mistake or they need something, or does that not even come into your mind?
You mean just out in general?
Yeah, in general.
So to some degree, the answer is still yes. The cute story is when Jerry and I were first married, she literally would make me keep my back to the room because I would just do this everywhere, and there was never any of this, right?
Oh, that's wild.
And
Yeah.
it was like, no, you need to pay attention to me. So I was terrible. And then obviously as the years have gone by, I think you get busy and you just don't like focus on that as much. You're not thinking about it all the time. So, I mean, to the point where even I run into my own patients and either there's been so many and I don't recognize somebody, or I just don't look at it the same way. But if something's really glaring, I do.
Right.
For sure.
And we all do.
Yeah, exactly. Yeah, I'm no better.
We would love to play a little rapid fire
Uh-oh.
boob
Okay.
job edition.
Okay.
So we're just going to ask a question, then you can just answer as
Okay.
you say. Saline or silicone?
Silicone.
Over the muscle or under the muscle?
Changed more over.
Oh,
Yeah.
okay.
Most common cup size requested?
C to fuller C.
Favorite celeb look or biggest inspo picture people come in with?
Oh, oh my gosh, I'm drawing a blank on the name, the model, Radikowski.
Oh, yeah, yeah, yeah.
Yeah,
The
this,
yes,
yeah,
yes,
yeah,
Emrata.
right.
Oh,
Sports Illustrated swimsuit and all that. Yeah,
that's almost more natural
yeah, more
looking.
natural, but
Wow.
full.
Yeah, yeah. Very
Not
full.
fake and not stuck
Yeah.
on, but full and soft.
Ooh.
Yeah,
What
pretty
age do
common.
most patients come in?
Really varies. I think it comes in two main groups for breast. It comes in, the younger girls, anywhere from even 18 to 30, and then the moms who, life has changed things, and then they're coming in for, sometimes they just still need an augmentation, but sometimes there's some life changes that have happened, and we're talking about lifts and things like that.
Lift or implant.
Um, it's not even an either or. It's usually if you need a lift, you need a lift. Because putting a big implant in, trying to avoid a lift is a mistake. So the most important thing that people pick is size. Once they pick size, it's my job to tell them whether they need a lift or not. Because not doing a lift is a mistake. It's kind of you're going to end up with a lift later and a
Yeah.
harder surgery and the wrong size breast.
Okay.
Can an implant pop?
An implant can fail. The old implants that were silicone, the gel was liquid, and when those leaked, it was almost like that popping, and the stuff could go places it didn't belong. New silicone implants are cohesive or gummy bear, or they're solid inside. We brought some. We'll talk about it. And they can break, but they don't leak in that way. They're always solid. You can still pluck it out all in one piece. A saline implant can pop. It can be a flat tire, and then the patient knows right away.
That's interesting. Okay, last one. Big or little?
I'm a much bigger fan of a smaller, pretty breast than a big breast. I think there's a size for everybody. My job as a plastic surgeon is to give each patient what they like. But if you want to stay away from people like me in the future, you have a small, beautiful breast. You don't have a big, heavy breast.
Do a lot of people come in asking for something that's a bit overwhelming for their body and you're like, nope, not doing it?
I think some people do. In my practice, not as many, because I don't think I'm known for making really big breasts. If you go on the website or look at before and afters that I've done, they're more tasteful usually. So I think my own clientele kind of develops
Shit.
itself.
Yeah.
But if somebody comes in and wants to be big, it's my job to make them happy, but make it safe at the same time.
When I got divorced, I bought myself a Range Rover and big titties. That was my gift.
Yeah,
And I came to you after to go smaller.
right.
And I remember my husband was like a little stressed out about it. He's like, I love your breast. I don't want you to go smaller. And you kind of said, let her do what she wants. And I said to him, it's like driving a Hummer or a Ferrari. Like, I'd rather have a Ferrari. I want it to be smaller, fit my body. And that was like really life-changing for me because the way you did my breasts fit my body. It made me feel really good in my skin. And when I met Brittany, you didn't really have implants when I first met you.
No, I've had them since I was 18 years old.
Well, they were really small.
I had-
smaller.
I had large ones. I took them out and I put smaller ones in. And I went through like that whole sort of reconstructive surgery. And then I went to Dr. Schwartz and we talked about it. And we ended up, I didn't want to be huge. And I was worried about the size you were putting in. But we had to have the discussion that I had to go bigger because I had no breast tissue. Like I was so flat before that you had to put something bigger to fill it out. And I couldn't be happier.
Right.
I've never been happier with my boobs. Thank
Well,
you.
I remember when I was in my recovery and you had, you hadn't gone to Mike yet. I remember showing you my scars, being in bed and showing you everything.
were
And
incredible.
you're like jaw dropped. And that was kind of the
Incredible.
impetus for her to come and see you.
Right. So that was the perfect example of how different everybody's path is. Every single woman that walks through the door has a different need or a different goal or a different anatomy or a set of issues that we have to address. And that's what actually makes it fun for me, right? You went back to the beginning when we were talking about being an artist. Every single surgery is an art project every day. And even if I'm doing the same surgery on two different people, there's always something different about it, which is what makes it so fun for me. The Hummer to Ferrari, I have to use that line. I like that.
Yeah, it took a lot of convincing because the men get kind of attached to that. But I can't tell you, I think every week he'll say to me, your breasts are perfect for your body. They are great.
Well,
So
I think the last piece of that puzzle is if mama's happy, everybody's happy, right? I think if you have a breast that you like and you feel sexy and comfortable in, then your partner is going to probably have a lot more access to that breast, whatever that means, than if you're, uncomfortable or they're too big or you can't wear the things you want to wear. All of that is really about lifestyle choice, and, happy patient, everything else kind of follows.
And because we are such good friends, people ask, "Is it weird that, you see my breasts?" And I I have had many dinner parties with you and Jerry where I'm like, "Come in the bathroom, guys. Look at my boobs," and you're just always so professional, and I'm so comfortable with you, and I think that that's something that's very important for people to understand.
Well, that's very kind. I think that, my perspective is, there are people who are friends who want me to do their surgery. There are people who are friends who aren't comfortable with that. And for me, I feel like it's an honor if somebody that I know and I really care about asks me to take care of them. So I'm certainly proud to do that. If somebody says it the other way, that's okay too, because, I'm happy if the friendship comes first for them. So it's whatever everyone's comfortable with. But yeah, it's nice to kind of be me in this place and have people that you care about ask.
From beginning to end, I will say it's an incredible experience with you, with the office, the recovery. It's much easier and much more manageable, the pain going through you. I've done it many times and it
Yeah.
was incredible.
The recovery is very easy.
It can be. I think that's one of the like joys of feeling like a really, really good surgeon is the elegance with which you treat the tissue. It's not just about a result. It's about how do I achieve this in a way that makes it that. And for me, what you're saying is really important. Is there are a lot of people out there who do beautiful work, and if you ask a plastic surgeon who the three greatest plastic surgeons they ever met were, they have a hard time thinking of the other two.
That's
But
funny.
but the bottom line is there's a lot of people that do good work, but the second part of it is how do you deliver that? And for me, that's what we've built that's really important is we've built an office that's comfortable. I have the most amazing staff I've ever had in 27
Very
years.
true.
And I want people to walk out of surgery with me not just saying, "Oh my God, I love my breasts," or "I love my face," or "I love whatever," but this was the very best place I could have gone for every other reason as well. So for me, that's a really huge part of what we can deliver.
Well, but let's get into all this. But I want to say this really quick. I
Yeah.
have 8 mommy girlfriends who are like some of my dearest, dearest friends. And all 8 of them, they've all had them done by you. And I think 4 or 5 in the last couple months have all had redos, right? They've all
Okay.
had revisions
Yeah.
and or mommy makeovers, which we'll talk about. And you have one more coming up, another friend of mine. So all 8 of them,
Oh, wow.
all of them.
Yeah.
That's
Well, I
a
always tease,
tribute to you.
I get around. Um,
Yes.
it's we live in an amazing community. People are blessed to be able to do these things from a financial or whatever standpoint, and then you spend a long time building your reputation. I was taught that you don't market. You don't go out there and kind of promote yourself and do all of that. You let that come to you. And so for me, it's always been about doing the very, very best work that I can. I was blessed to train with great people, and then the rest takes care of itself. So I obviously love hearing that. I'm proud of that.
I'm proud of that too.
Thank you.
Let's talk about the goodies.
All right.
All
Well,
right. What do you have?
so one of the things that's really different when we talk about breast surgery is implants. Implants have evolved tremendously over the years that I've been in practice. Right in the beginning of my practice, we weren't even allowed to use silicone implants. The FDA had banned them because they honestly weren't a great device. And so we were pretty much only putting in saline implants. And a saline implant is okay. There's a lot of people out there that have saline implants and they don't look bad. But for some people, they're too firm or they ripple or they slosh or eventually they can leak and have a deflation or a flat tire. And, then silicone came back on the market. The newer silicone was better. But now in the last few years, we have an even better version of that. And
Is it just, it's a different silicone or is it just like the casing that's different?
both. It's actually both. So the silicone gel in the past was much more liquid, and that liquid was really soft, looked great, felt great. But then if this outside shell of the implant ever broke, that gel could go places it didn't belong. And that was the big controversy. So then they came up with better gels that were more cohesive, or gummy bear, actually more solid on the inside. But they had other issues in terms of, did they last as long, or were they also too firm, or, did they sit properly in the body? And then now we've come up with this latest generation of implants where the shell is slightly different. So the risk of getting an abnormal scar around the implant is less. The rupture rate of these implants is so low compared to older implants. So much so that 15 years from now, well over 90% of them are still going to be fine. And we don't do that 10 to 15 year thing anymore with implants. If you love your breast, if we've done a great job for you and you love your breast and you're like, oh my gosh, there's nothing I would change about this, then we just keep surveying it. We're not telling
There's
you to
no
change it.
magic number.
There's not. We used to say 10 or 15 years and you're going to mark your calendar and you need another surgery.
And why would that be?
Because the statistics showed that many of the implants were starting to fail at that point. But that doesn't happen with really almost any implant after 2012, 2013. It's just a newer generation. There's some exceptions to that, but most of them are much safer longer.
That's amazing because I have probably 50,000 more miles left.
That's right.
That's perfect.
You just have to rotate the tires a little bit, but yeah, you definitely can have a lot longer than the 10 to 15 years.
And then size-wise of
Right.
these, like the implant you were just holding,
Yeah.
how many cc's would that be?
Well, I can tell you it's actually on here. This is 275. And so I brought a variety of different implants because this one's kind of a little more flat like a pancake. This one's in between, and this one's even a little more round and bally. So the beauty of this gel being solid is not only do I have a softer, safer implant, but I actually have way more sizes and shapes. And so when a woman comes in, she's going to not just tell me how many cc's she likes or what size she wants to be, but I can actually measure the dimensions of her body to pick an implant that's going to fit on that frame. And then I can adjust how much the implant projects as well to give her the look that she wants and the volume that she wants, but still not get outside the boundary of what's safe.
And not every implant is the same on each woman. So if I have a 250cc implant, but I have breast tissue, my breasts are going to be a larger size.
100%. Everybody comes in all the time and they've looked at a picture on the internet that says 250 cc's, and I love how that looks, or 300 or whatever it is. And it's literally apples and oranges. Exactly to your point is it matters where you start. How tall are you? How wide are you? How much breast tissue do you have? Are your ribs more round this way, or are you more caved in? Everything affects what that final result is going to be. And so that's where my job comes in. That's back to the art project, right? Is figuring out what it takes for each person uniquely to get them the result that you want.
What about explants? I know that was a big trend where all these women were maybe having other issues that they attributed to toxic breast implants, but
Right.
now they've been taking them out. And I've seen a lot of people on the internet talking about it's actually toxic mold that was giving them all of these
Right.
issues.
Right. So you brought up a lot of points there in one quick question. So let
Mhm.
me hit on as many as I can. I think the first thing is this is a topic that I have a lot of biased opinions about based on all the research that's done. Plastic surgery has gone a lot more from an art project to a science, and this is one of the places where there's a lot of science. So what I mean is that in the last 10 years, there's been a lot of studies that have shown that there is absolutely nothing in implants that has been linked to a specific disease. Having said that, science doesn't know everything. So maybe some people's biology just doesn't do well with a foreign device, whether it's a breast implant or some other foreign thing that we put in the body for medical reasons. We can't know all of that. But what happens when you're somebody like me, I always tease I'm kind of at the end of the funnel of breast surgery, right? People come to me for first-time surgeries, but they come to me with a lot of problems that need to be fixed as well. A lot of the women who ask to have their implants removed will come back 6 months later and say, I don't feel any different. I wish I hadn't taken them out. I want to put them back
Wow.
in.
Yeah.
Some people will feel better. And then the problem is that we don't know whether that's something here in the breast or whether that was something here. But the science doesn't support that cause and effect relationship. So look, a woman has a choice to put it in. She should have every choice to take it back out, whether it's emotionally, I don't feel comfortable, or physically, something's bothering me. But I don't think that any surgeon can really promise you that you're going to cure a disease by taking out an implant.
I like that.
Yeah.
Now, post-surgery, it used to be that you couldn't wear underwire bra, you should wear underwire bra, sleep with a bra, don't sleep with a bra. What's your thoughts?
So I think it depends on what surgery we're doing. First time surgeries, I don't keep patients in a bra the first week, but I want them in the bra 24/7 after that. the first 6 weeks, because I think it's like putting a cast on a broken arm. You want to hold that breast where you want it while things are healing on the inside. The scar on the inside around a new implant isn't very strong for a while. So holding that breast up where you want it is really important. From 6 weeks to 6 months, I think that scar is still forming. I think you can cheat a little bit if you have that backless dress or a bandeau top or a vent to go to where a bra is not going to work. Then you can take a few hours out of the bra and do those things from 6 weeks on, but not that much and not that often. And then by 6 months, the scar is strong and it becomes your breast to choose what you want to do with it. I always tease everybody, if you knew everything I knew about breasts, you would leave your bra on as much as you could. But if you choose not to, that's your choice. But the gravity and Mother Nature and just the strength of your own natural tissue is going to be affected without
I am a
support.
rule follower and I am a around the clock bra underwire. I am keeping these things as high up as I can for as long as I can.
You're not only a rule follower, you are the surgery police.
I am the surgery
And
police.
you chase all of us around if
And
we're
I
not following the rules.
I tell.
All right,
She's
I'm
how
gonna-
she's a
I
talent
tell-
teller.
I'm going to come hire you when I have one of those patients.
Oh, you don't even need to. I
Yeah.
call your patients and I let them know that I've seen them running too soon, or I've heard that they had sex too soon,
Uh-huh.
or I've heard that they were carrying their luggage too soon.
Yes.
And I said, if you have problems, I'm going to call Dr. Schwartz and tell on you.
Awesome.
Yes.
Love that. So it's the hardest part because you mentioned it before. Surgery wasn't that hard. It doesn't hurt that much. I feel pretty good. But the downside of that is I'm doing too much too early. And so we really, really emphasize that part to patients. But, I can't be there policing them. So I'll just count on Brittany.
That's right. You wouldn't let me drive.
I wouldn't even let you shut your car door.
That's right.
Well, that's a big door.
Or refrigerators. Yeah. Or refrigerators.
Yeah.
I was like, get somebody to open that.
Yeah. I think the fridge is okay. But, the big car door, maybe not. So.
Is it true when you sleep and you don't wear a bra, there's micro tears that happen as you're turning side to side?
So I think the way I always tell patients to think about it is if you're standing, then gravity's acting up and down and breasts are going to go this way. But when you're lying in bed, they're going to go that way, right? And so if you support yourself from the side at night, that's kind of what I want. There's no question that tissue stretches over time. So the more you protect whatever direction gravity's pushing, the better you're going to do.
And thoughts of underwire at night.
So I don't think it needs to be an underwire at night. I honestly don't
But
necessarily think it has
does it
to be.
affect you in a negative way? Like I'm underwire every night.
No, not at all. I think the idea is my 2 rules for bras are that you love how your breasts look in that bra and that you're comfortable and you can leave it on so that you'll actually wear it. So whether it's a cup or a wire or a sports bra, it doesn't really matter to me as long as it's holding you in the right place and you're willing to wear it. So it doesn't have to be a wire at night.
Okay.
Yeah, for sure.
Well, let's also get into the mommy makeovers, the whole
Right.
getting it all tightened up after losing it all during that 9 months.
Okay. Well, to me, the first part is I don't necessarily always love that mommy makeover term. Because mommy doesn't need to be made over, but there's some stuff that needs to be fixed
Let's
up.
rename
right?
it. What do we want to rename
So,
it?
I don't have a good name for it. I just think the idea is everyone's really different, so that one term like that doesn't really reflect what each individual person needs. I don't know. Somehow it just seems a little disrespectful.
We're going
to
to
me. I
ask
don't
the
love it, so.
listeners to help rename that.
Yeah,
I love
rename
it.
mommy
Let's
makeover.
pick a
Yes,
good. Let's
let's
pick a good
rename
name.
it.
But
Yeah.
I just never love that name. But anyway,
I'm kind of with you.
from my perspective, it's when you're doing more than one thing, right? So if we have breasts and we have tummy or a little lipo or whatever that is, combining all of those. And then the first question that always comes up is it safe to do that all together? And the answer is there's a certain window of surgery, about 5 or 6 hours, where we feel like surgery is safe. The anesthesiologists are happy, and we'll do whatever we can fit in that amount of time. Once you get past that, then it's important to divide that up into more than one surgery if somebody needs
okay.
it.
What's the
Yeah.
most amount of procedures you've done under one surgery?
Well, it's probably going to be something like someone coming in for, a breast augmentation with a lift, some liposuction, a tummy tuck, and maybe every once in a while, I will rarely do some fat grafting somewhere, either to the butt if someone's really, really flat. I'm not about making really big ones, but there's always that woman who comes in and literally without a belt, her pants fall down and she just needs a little curve back there. And so moving fat from one place you don't like it to somewhere else is a great tool.
I could use it.
So those are probably the kind of combinations where it's the most at one time. There's probably other examples, but that's pretty typical. And that will get to be like 5 or 6 hours. when we do a longer surgery like that, we actually have a beautiful aftercare facility in the office. And I don't even allow patients to go home that first night, whether it's comfort or whether it's safety. I can do better. And so we just have a beautiful suite with an aftercare bed. I have a nurse with the patients. I have a medical assistant with the patients, whatever medications they need, monitors, all of that, so that everybody sleeps at night the first night and knows that everything's done properly.
So that fat grafting is not the same as a Brazilian butt lift.
Well, it's the same technique, but not the same volume, right? So one of the most dangerous surgeries that is done in plastic surgery is the Brazilian butt lift. It's because if that fat goes somewhere that it's not supposed to go, it can actually be life-threatening. There's
That is
literally
crazy.
Scary.
no
That is
procedure
scary.
that's done that has a higher risk of death
Is
than the
that because it
Brazilian
gets
butt
in
lift.
arteries or?
Gets in a vein, yeah.
Oh,
In the
that's
muscles
awful.
of in your butt, in your glute muscles,
Yeah.
there are veins that are almost this big. And if a cannula goes into one of those and that stuff goes the wrong place, it can be life-threatening.
Wow.
Many states have regulated how that gets done. They've regulated how much volume can go in. Florida especially has very strict rules about it. For me, a little bit under the skin in the fat of the butt
Yeah.
is great. But when you start doing more than that, there's very high risks.
I
Yeah.
might be coming in for that.
There you go. You
Yeah.
have to have some to donate first.
That's a good point.
Well, I actually had a friend tell me recently that she gained a little bit of weight to take the fat to be able to do a little bit in her
So the trick with that is you have to
tush.
keep that weight on afterwards,
Because
right?
it
Because if
lives,
you
right?
lose some weight, then those fat cells are going to shrink back up and you're not going to get much out of it. So it has to be weight you're willing to keep on.
That brings me to the fat transfer into breasts.
Yeah. So fat transfer to the breast, first of all, for a long time, people worried about whether it was safe. And what we learned is we learned from our breast cancer patients that not only is it effective in filling defects from mastectomy or lumpectomies, but it's also safe in terms of mammography, because that's what we worried about the most. The second piece was you're taking fat from one place and you're putting it into an organ that just had a cancer. And is it going to change that? And the answer is no. So we know from many years, over 20 years of fat grafting into the breast for breast cancer patients for reconstruction, that it's very safe to do. The second part is how much can you get if you do it? And the answer is maybe up to a cup size. So let's say an implant like this is 275 cc's. Most of the time, 100 to 125 cc's, maybe no more than half of this, is as much as I can get in fat grafting.
Would you ever, do you couple it with implants or
Yeah.
to fill certain spaces that
we
wouldn't
do for
fill?
sure. So we call that a composite augmentation, and it's a more modern thing to do. A lot of times a woman needs a little bit of volume from an implant just to get the projection. But let's say her cleavage is really wide and I can't push it any closer safely. I can use some fat to make that better. Or let's say she's had breast surgery before and she's got really thin areas and there's some rippling. I can use fat to cover that while I do something else. So fat and implants together is a very much more modern and common thing to do.
Is there a percentage of die off of the fat, or does it all live?
Doesn't all live. So definitely somewhere between 60 and 80% of what we graft is going to survive. And it really depends on where we're putting it, how close we push that. If you're injecting fat in the face, let's say we're doing facelifting and thin areas in the tear trough or hollow areas, we don't ever overcorrect because it's really hard to get back out and too much fat looks too full. We see that person when they do too many fillers. You don't want to ever create that. Fat grafting into the breast, about 60 to 80% will take, and we'll overcorrect a little bit with that because we know that's going to happen.
Where's the best place on your face, like the best result for doing the fat grafting?
For me, I think it's two places. I think doing fat grafting around the eye and the tear trough, because when we lift the cheek up, we can lift that up, but sometimes people are still hollow under there, especially women as they age, lose more facial fat. And then also just kind of the apple of the cheek. Sometimes people have lost a lot of that volume, and it's a really good place to do it. Other places that people do it that I don't are in the lips. I don't like fat in the lips. It's really hard to shape the lip with fat. If someone really has a pencil lip, you can put a little bit in and give them some volume, but you really want to use a filler to shape the lip, to really get the Cupid's bow, to sharpen the edge of the lip so it looks nice. Fat can't do that.
Okay.
So fat isn't as ideal for the lips as filler is.
Okay.
Yeah.
And I want to take it back to body again really quick, because I
Sure.
think that there's like this misnomer with doing like tummy tucks on women, right?
Okay.
Like fixing the midsection. And
Right.
I think that women are terrified of this.
Yeah.
And a lot of times when you ask why, oh, why wouldn't you do it? Because the downtime, the healing, they're afraid they're going to be crouched over. They're not going to be able to stand up straight. And I've had a couple of my girlfriends that have done it and they've had a great outcome and the recovery was quite quick.
Yeah.
Can you explain to us just a short bit of what that looks like in your office?
100%. So tummy tucks get done differently by different people, just like everything else. And the two things that I do that are really different are that we've evolved the technique where patients don't need a drain anymore for a tummy tuck. So number one, the discomfort that comes from that. And number two, the incisions, usually we would put those drains in the pubic area and nobody has pubic hair anymore. So now there's little scars and,
Oh, right. That
so
makes
there's not a
sense.
good place to hide the scar for the drain. But what
Uh-huh.
we've learned is we can sew the inside differently where we just don't need a drain anymore. So for the last 10 years, I haven't even done that. The
Okay.
second thing is that we have this beautiful numbing medicine that lasts the first 3 days after surgery. So those first 3 days when the discomfort is real, that numbing medicine is in there working where the muscle was repaired so that you're already over the hump by the time that wears off. So I tease, I call it the no pain, no drain tummy tuck. It's not no pain, but it's so diminished that it's completely different than what people experienced in the past. I always tell the patients, don't go down the rabbit hole of the internet and read all that.
Oh, yeah.
Your experience is going to be different. In terms of the other things that you mentioned, it really depends on what kind of tummy tuck is done, how bent over somebody needs to be. So a mini tummy tuck doesn't have so much skin removal. It's more about the muscle. And those patients aren't very bent at all. So they're pretty straight right away and they don't have to do that
Is that
grandma walk.
like from pregnancy when you end up having
It's
what
it's the
Yeah,
muscle.
the muscle is typically
where
from
you have to like
pregnancy.
connect the muscle back together because you have it splitting apart?
Correct. So if you think about pregnancy, we all have our six-pack muscles,
Mm-hmm.
and those are side by side before kids. And then in order to make room for the uterus and a baby, that all has to stretch. And after pregnancy, the weight gain can come off and the muscle can be strong again, but the edges of those muscles don't come back together all the way. The barrel just gets more wide. And so by putting some stitches in on the inside, we can tighten that back up to where it was before pregnancy. And no amount of exercise can do that. So it's really like a corset on the inside,
Yeah.
cinching the waist back to a smaller circumference
Yeah.
and putting that back the way it used to be.
I have that where mine is split. It's not too bad,
Right.
but from the twins, I definitely I have like a cone when I go to do a sit up. But
Correct.
I'm one of those patients that's scared to have the downtime. So now I may
Right.
come in.
So the downtime goes in stages. Driving the car is about 10 days after a tummy tuck because you really do need some time to rest. And most importantly, if the kids are in the back seat, you got to be safe. And then somewhere around 10 days, you can drive. 3 weeks, you start light exercise. And then at 3 months, the core muscles are strong enough where you go back to the gym and you can actually work harder than you ever did. And I always tease everybody, you can
Oh,
make
that's
both of
good.
us look better when you go back to the gym. So
Is there a tummy tuck that doesn't involve muscles? So there's like loose skin and you don't have that split in the muscle, but you just want to tighten that skin down there?
sure. In my practice, a lot of times women will walk in and they've even had kids and their muscle is still great. And so we don't do a tummy tuck. We do what's called an abdominal skin excision. It's the same removal of skin you would do with a tummy tuck, but there's no muscle work. And so that downtime is even easier. Exactly.
And is the scar the same, like kind of from hip to hip, or does it depend on the amount of skin that
It
you're
depends on the
removing?
amount of skin. Yeah, some people it'll just be a short little thing. Like a lot of women get a little weird bump from their C-section and it just shows in their workout clothes and all they need is to have that smoothed out. Other people, their muscles fine, but they have a tremendous amount of skin because that's just the way they stretched. And then we're doing the same amount of skin as a tummy tuck. Can be either one.
That's good to know. Now let's talk about faces because I
Okay.
know you're really doing so beautiful work there. I've seen incredible results with friends of ours, and I
Thanks.
know that's like a very newfound passion for you.
Right. So I was really fortunate to train in a place where two of the fathers of what we would call modern facelift surgery were. You read online or you get on Instagram or whatever, and it's, deep plane or vertical restore or smash facelift. All of those were techniques that were evolved in the early 90s.
And those are three different types of
They're actually
facelifts?
not. They're more people's names that they put on them. And the beauty of it is that facelifts have definitely evolved, and we're doing a much better facelift than what I was taught to do 25 years ago or 30 years ago. But the foundation of that facelift is really the same. It's that SMAS, which is kind of this tough layer underneath the skin and fat of the face. It's a layer that protects all the muscles and nerves. But by lifting that up, you get a more elegant facelift. It's a more natural pull. It's longer lasting. The scars are better because the skin isn't tight. So that facelift isn't new, but some of the nuances of how it gets done have been much more elegantly defined over the last few years. And people are just much better at doing it. So you look around and you see your friends that have had facelifts, and it's hard to tell as opposed to the old days where people looked a little more pulled
Yeah.
or their incisions were more visible or things like that. It's just a much better surgery today.
Where are you hiding the incisions? Like, are we doing around the ear? Are we doing behind the ear?
So it,
All of the above?
Yeah, it's kind of all of the above. It really depends on each person's anatomy and how much skin has to move. If a person's doing a younger facelift, we do a lot more of what I would call a maintenance facelift.
Mm-hmm.
I'm doing this for me. I don't even care if anybody else knows, but I'm going to look in the mirror every day and be happier. Those patients don't have a lot of skin. It's more of these deep layers that we're moving. And so the scars are pretty short. They're typically still around the ear that have to be just sewn elegantly so they don't show and behind the ear, but they're not up in the hairline so much. And then as a patient gets older and there's more and more skin, then the incisions have to be a little bit longer. And that's where it gets important because they have to kind of be in the edge of the hairline so we don't distort it. And it has to be sewn just perfectly so that a woman can put her hair behind her ears and not think about having had surgery once everything's healed.
What
Amazing.
ages are we doing facelifts now? Because when we were
That's a great
younger,
question.
the older women, you could really see the facelift. Their skin was loose and you can kind of see like the pull in it.
Right.
And now I feel like it's going much younger and maybe there's more than one facelift happening in their lifetime.
Right. So I think all of that's correct. When I started, a facelift was a 60, 65, 70-year-old kind of surgery. And it was a woman kind of either at the end of her career or retired and just kind of pissing off all her girlfriends in her bridge game or something. It wasn't a young woman doing it so much. And as the years have gone by and our techniques have gotten so good, it really is a much younger and younger patient. So I will see patients in their later 40s. And even though there's not a lot going on, there's enough where we can really make a difference that they're going to be happy
Is
with.
there like a too young?
I think there is. I think a lot of times because this trend has happened, women are coming in and being hypercritical
Yeah, we live in that world.
and live in this world where it's like, no, you know, it, it's a little early. You're not going to get as much out of it as what you're trading. And that's what I try to tell them. Look, there's going to be scars. You're going to have a downtime. There's a financial expense to it. You have to kind of weigh all of those things versus how much better it's going to be. The mirror's the answer, honestly. When somebody's looking in the mirror and they have reasonable expectations, it's time to do it. That's
Is there once you've done this, right? Okay, someone has a facelift with you. How many years later do they need to come back for a tune-up?
So I think it's really individual. It depends on your skin quality and obviously your personal goals. Typically, when we do a facelift, I tell patients we're going to turn the clock back about 7 to 10 years. And you're always going to be those 7 to 10 years better. You don't age like this and catch up again. You age like this and you're always that much better. But at some point, usually somewhere in that 7 to 10 year mark, someone's going to look in the mirror and go, okay, do I go on a vacation or do I want to do this again? And a lot of gals will come back and do it again, especially because we're starting younger with the first time.
Now, we're not all doing the entire face. Sometimes you're just doing a lower face, maybe an eyelid. That's
Correct.
kind of the misnomer. People think when you have a facelift, it's everything, but there's certain things you can do.
Right. So a facelift to me is kind of cheekbone to collarbone. All that has to move together so that you look natural. And then there's eyes, and then there's brows, and then there's lip lift, and then there's laser, all those different things. And again, as you guys asked, it's different for each person and what's changing on them that they don't like. And also what goes along with what they're asking for. In other words, sometimes if I do a facelift, I really have to lift up the corner of the brow so it doesn't look funny. And that's,
Yeah.
that's the part where sometimes people come in and, what I'm going to recommend might not be what they're expecting, but they really have to do certain things to look natural. So that's all a part of evaluating
And that's
them.
why you, as we said earlier, with your meticulous eye and your love for art, you really do give that in, head to toe for your clients.
Right, 100%. I think obviously at some point in the youth of your career, you're afraid, oh, someone's going to think I'm shopping. I want more money. But the reality is that I want somebody to leave and look in the mirror when they're done and go, oh my God, it looks just the way I want. I look just like me. Everything's, it's just all of the things that bug me are gone, but I'm still me. And if you don't point out some of the things that have to happen, you can't achieve that. So you really do have to educate them. Sometimes you point out something and they're like, oh my God, that was bugging me. I didn't know I could do that. That's also an important part of it.
It's like an addiction. I want to come see you tomorrow. But in your practice, you guys not only have an incredible plastic surgery part, you guys also have a whole other side, which is like a med spa department. Is that what we
Correct.
call it?
Yeah, 100%.
Which is also equally as incredible, which keeps your patients looking younger. You can go there without having to go into the surgery portion, but you can also go after for maintenance for your lasers, your Botox, your fillers, all the state-of-the-art stuff that you guys offer. And I always look at your beautiful wife and all of her friends as our pillars or our billboards for what we should all look like,
Oh, that's sweet.
as we do age. And will you tell us a little bit about what that is for the listeners? And I know you brought some fun stuff, some fun products today as well.
I did. I brought some goodies.
Let's get into it.
So the med spa is definitely the adjunct to the practice, right? When we're talking about being youthful and looking your best, it's not just about surgery. And whether it's before surgery, I always tease patients, this is a way to stay away from me a little while until you're ready, or whether it's after surgery and you've invested all this time and money and healing into a procedure, how do we take care of you afterwards? So our med spa I have 5 different nurse and physician assistant injectors that do the Botox and the fillers and the lasers and all of that. And then I have a wonderful esthetician that does skincare. So you can come in and actually have a full skin evaluation and actually know what are the right products for me to use for my face, because it's not the same for everyone. You may not need the same moisturizer or cleanser or, all the different products that we have. And that's where somebody who only looks at skin every day can help you with that. And then the lasers are a good way, whether it's treating scars or whether it's treating redness or whether it's tightening up skin that all the surgery doesn't change, we can change that. And then the last piece of the med spa, which is a part that we're growing right now, is the longevity piece, which is GLP-1s for weight management, which is peptides for wound healing and hormone management. That's all part of what we're building and expanding to help all of the patient feel well, not just the aesthetic part, but the physical part of you as well.
I love that part, and I'm so excited for
Yeah.
it.
That's a big game changer.
Yeah.
It
That
is.
really does change the quality of your life.
It does. I feel like, especially for women, hormone replacement, testosterone, estrogen, progesterone, thyroid, getting all those things in balance is the fountain of youth. If you're not being seen and getting those things addressed, you're not able to really be your best self. I think that there's been lots of controversy about that in the past in terms of whether it's okay to do those things. But all of the studies that show heart disease or breast cancer or other issues were bad because of hormone replacement have been debunked. And a woman needs to be seen and evaluated for that and be on an appropriate regimen to be as healthy as she can be and to be able to live her best life and to be able to look her best. So I think it's all really important.
And bioidentical hormones.
Correct. That's the key word, is bioidentical. In the past, hormones were not made exactly the same way that our body makes them, and they had side effects. And so that definitely did cause issues. But today, in the lab, they can make what are called bioidentical hormones, where they are exactly the same molecule that we have in our body. And when we replace with those, the body responds to that appropriately, and it's a game changer.
There's one peptide that I can't live without, and I know you and I talk about it a lot, which is BPC 157.
Right.
I love it. I have arthritis in my thumbs from all my texting. And when I take it, it's gone. And
Yeah.
I completely I can't live without it. And I think there is also a stomach element to it. Like it helps with your digestion.
It does. It's both. So BPC 157 is a peptide, a very small protein that's made in our stomach. So it's a product that's actually something our body already has. It's the only one that you can actually take orally, because the rest of them break down if they go in your stomach, but that one's fine. And it is both involved involved in wound healing and in GI type situations, and it works really well. My personal story with that is that I had already had one hip replaced, and right before my daughter was going to be married, my other one started acting up to the point where I had already scheduled my surgery for the other side, but I didn't want to do it because the wedding was coming up, and I had just started learning about this peptide, and I started taking it myself, and literally it's been over 2.5, we're going to get to 3 years, and my hip is great. Like, I don't need surgery. I have some arthritis in my thumbs too, probably from sewing and doing whatnot all the time. And it's better with that as well. So I'm a huge believer in peptides. I think peptide therapy, BPC, and several other peptides are going to be the future of keeping you healthy and treating a disease before you get it, as opposed to putting a band-aid on a disease after.
Can people call the office now and get in for that longevity component?
They can. We aren't offering all the things that we're going to yet, but there's definitely several of the peptides that we're doing, and other things that they can definitely come in and start seeing our staff.
I suggest all of it.
Yeah.
And I suggest you start doing voice dictation.
I do voice dictation. Oh,
Yeah, protect
yeah.
those thumbs.
Yeah, I know.
You need them.
I'm such a fast texter. It's like unbelievable. I think I could be in a competition. I know it's true. Well, I know you have some goodies in that bag. I want to see what you
Yeah,
have.
let's talk. So I wanted to bring a few things that are my favorites. And then I also wanted to bring a couple things that were the ones that I use, because, we think about, I know you're talking mostly to the ladies in the audience, but the ladies in the audience can kind of protect their hubby skin as well.
Oh, yeah.
Absolutely.
So I think the foundation of skincare is just a few components, and then just the products that you like. So the first one is a good facial cleanser. There's a lot of different ones that you can buy. I think you need to use an abrasive cleanser at least 2 or 3 times a week. That takes off some of the dead skin cells and polishes the skin. The one that I use is this ZO exfoliating polish. I just do it in the shower.
But this is gentle enough for women to use
It
as well.
is. Again, you don't want to do it every day.
Yeah,
It's actually
okay.
a little too much to do on your skin every day, but 2 or 3 times a week is all you need to do. And there are a lot of different ones. We have several in the office because some people can use a more abrasive one. They have thicker, tougher skin. Some people actually need it. And other patients need a more gentle cleanser that still does that to a lesser degree. I think the second thing is you need a good moisturizer. The one that I actually have Jerry use as her foundation every day is this Elastin Hydra Tint. This is a beautiful moisturizer. It feels great when you put it on. It also has a little bit of a tint to it as a foundation. They make one without the tint, obviously, because some people don't want that. And it also has a 30 sunscreen built into it.
Oh, I use that.
That's what I use for my
It's
sunscreen.
really fantastic because even on my skin, men, don't put on something with a tint or whatever.
Mhm.
But once it rubs in, it sits in really nice. It doesn't look like
Right,
you
it
have
doesn't
that
look like
on.
you have makeup on.
And it's a really good long lasting coverage. And the way it feels is very smooth. It doesn't feel like you've got something on. So that's that one. And then want to talk about Retin-A a little bit. Is this the right one? Yeah. This is my we call it the MRS cream,
Wait,
Michael
what is-
Robert
Is that
Schwartz cream.
compounded?
this?
Does that
It
look
is. This is
compounded?
a compounded.
Oh, look at us. We're like,
we get-
"Ooh,
I know, everyone gets
ooh."
Is
excited.
this new?
So it's not new, but this is a compounded Retin-A cream. We get it in different strengths. It has Retin-A. It has 2 different bleaching creams in it, hydroquinone and kojic acid.
Oh, I like
So
this.
the idea of bleach, everyone kind of always thinks about putting whites in the wash. It's not like that. It soaks into the skin
Is that what it
and
says? Makes
turns
me
the
like it
pigment
more.
cells down so that as the new skin floats to the surface, the pigment is lighter and more even. And has a little bit of steroid in it so it doesn't create inflammation from the Retin-A. So I pretty much think that everybody should be on this. Sometimes people are a little sensitive and we can mix it to a
Is
lighter
that-
strength.
So you can make that specific for a client. So you can.
We do.
Okay.
Yeah, it's
So
exactly
for
what we
someone
do.
like me who I have very sensitive skin. I'm like a flower. You touch it and
Right.
all the petals fall off. I mean, really, it's terrible. I get rashes all the time.
Right.
What do I have? It's dermatitis.
Right.
So for me, retinols are they're
Right.
harsh.
Right.
It
So
makes you photosensitive too.
it can make you photosensitive. The secret is we used to tell patients if they were using this, they couldn't go in the sun. The answer is if you're going to go in the sun, you wear a hat, you wear sunscreen, and you
yeah.
can still do it. The idea is, 100%. We can have a variety of different
amazing.
strengths of the Retin-A. Sometimes patients just can't tolerate the retin-A, and we can make it without the retin-A or just with a retinol in it instead, which isn't as strong. And the other part of that that's really important is you have to build up to it. So you don't start doing it every night. You can start every third night or every fourth night and build up, because your skin, when women put it on at first, you're going to peel, you're going to have a little bit of redness. And then you actually have to work through that without stopping.
But the idea that you're customizing is magic.
Yeah, no, it's really important. And that's why we don't just buy
Coming
one
in
off
for
the shelf
that.
from somewhere. We actually have our pharmacy make it individual
amazing.
for each person.
And you have to refrigerate it.
You don't have to, but it lasts longer if you do. It'll
Okay.
turn a little yellow if it's out, which is still fine. It works fine, but nobody likes how that looks.
I
But
love the idea when you have to refrigerate something. I feel like it works better.
yeah, well,
get
I don't know if it
excited.
works better, but the trick is just getting downstairs to go get it. So
I like coming into your bathroom. I like to see what you have in your little refrigerator.
right? I
Yeah, it's
know.
fun for me.
I know. I always have a little something.
What's
So
this?
this is both for men and women. This is our hair product. You know, a lot of people start to get thinning hair. There's a lot of products on the market. So this is a combination of minoxidil, retin-A, and this will actually help you grow hair in places where you need it. A lot of
Wow.
people get thinner in their temples. I actually have a lot of hair, but you know, I'm getting old enough where I start to see a couple areas where I wish there was a little bit more. And so I
Yeah.
usually do this every single day.
Can women
you've
use this?
Women can use it as well. Yeah, 100%.
And you've seen a big difference.
I have, and I think that a lot of patients do. You know, it's not a miracle, but it definitely thickens things up. And a lot of hair transplant surgeons will use a similar product for their patients to maintain those grafts when people have hair replacement.
That's amazing. I
So
think
another
that's,
great product.
that's like one of the number one questions I get is products for, you guys need to create something for thinning hair. You guys need to do this. And they ask me,
Right.
what can I get? And even for me as a woman, I'm starting to thin through here
Right.
terribly, where I hate wearing my hair back now.
Right. So I think this is one of those places where you can definitely see new growth. And, you know, patients who have been really thin, especially kind of centrally thin, will see an improvement where it's visibly and photographically different. So
Ooh,
And all of this is available at the Schwartz
it's
Institute.
all in the med spa at the Schwartz
Yeah,
Institute.
that's
I love this.
incredible.
So, and then I think the last one that is just the moisturizer that I use every day. This is just a facial moisturizer. It's made for men. It goes on afterwards. A lot of times for me, especially, I get really dry under here and it looks really crepey, and a good facial and eye moisturizer is great. So this is just the Skin Better, which is a line that we have in the office as well. It works great for my daily moisturizer, and they actually have a really, really good sunscreen that I use when I go golfing. I want to make sure that I'm protecting this skin so that it hopefully lasts as well as possible.
And not only your face, you're protecting your ears.
Yeah, especially ears. You know, you think about wearing a baseball cap. In Hawaii, I have this big dumb hat that I wear because there's just so much light. But I'm putting sunscreen on my ears all the time because, you know, we'll see skin cancers on the ears, especially in all these exposed places, and people don't think about putting sunscreen there. So you've got to do it.
Well, this is my type of party favor.
There you
I
go.
love all this stuff.
Well, you let us know what you need. I think we know somebody that can hook you up.
Well, amazing. We are going to put up all the information for the Schwartz Institute and where our viewers can find you guys and book appointments, book medical spa services, and get all these amazing
Purchase all these
products.
amazing products.
Sounds great. Yeah, I think you brought up one point that's really important is we do kind of have the separate sides for the med spa and the office. You're walking in the same door, but you know, a lot of times patients feel a little weird if they had to walk through a plastic surgery office to get to skincare and other treatments. But our spa is completely separate on purpose for that reason. You can just come in, get your stuff done. It's not like waiting around in the doctor's office. We've built this really special place. So
It
yeah,
really is
come see us.
exquisite.
It's-
And from a designer's point of view, it's beautiful.
It's
Yeah.
I love
stunning.
going there.
I give all the credit to my lovely bride for that.
As
She
you
really
should.
helped build a place
Yes.
that, you know, we wanted a place to be able to walk in and feel comfortable and also feel
So proud.
that level of taste
Mhm.
and, you know, like, okay, these people know what beauty is and what matters. And, you know, I feel like we've really kind of hit the nail on the head. I'm really proud of it.
Yeah, it's incredible.
Yeah.
I want to say that, you know, you're our good friends. And we started this podcast, What She's Having, because people do ask all the time, what are you doing? What are you having? But I always look to you and to Jerry, and I always say, what are you doing, Jerry? Where are we going? Where's our doctor, Jerry? What injections are we doing? Because both of you live that life and you walk the walk and you look incredible, not just for your age, but like just you look incredible. Your life is vibrant and active, and we all look up to you.
Oh, it's super kind. I always tease I've just got to keep up with my beautiful wife. I mean, when you have somebody that special in your life, you really have to keep up. So I love the fact that she's somebody that you guys look to. I think that's smart. She's doing everything right. And for me, it's been a huge motivation to be my best self, to keep up with her and be her best partner. And yeah, it's really important in life to have that. So
Well, we want what she's having,
yeah,
and we want what you're enhancing.
thank you. Well, I'm here for both parts of that, and it's a it's a really treat to be in this place where I can help deliver that. So
Thank you
thanks.
so much for coming today.
Thank you both. It was
Thank
fun.
you so much.
Yeah, it was a pleasure.
Thank you.
Cool.
If you laughed, gasped, or immediately Googled flights to Paris, we did our job.
Don't forget to leave us a review, 5 stars only, please. And follow along for behind the scenes madness on Instagram, TikTok, Facebook, and YouTube at Official What She's Having.
Catch you next time, and until then, go get yourself something fabulous.